What's up, everyone? Welcome back to the Daily Sean. For those of you who haven't been here before, my name is Sean. I do a daily video on something related to nursing. No rhyme or reason. Probably not going to change. Oh, you're a nurse? Gee, why didn't you become a doctor? Don't you want to be a doctor? Contrary to popular belief, and this belief is way more popular than I ever imagined, becoming a nurse was actually a conscious choice. I'm not a doctor. I'm not a dropout from doctor school. It's not because I'm not smart enough to be a doctor. I actually chose, with intent, consciously chose to pursue the particular profession of nursing. The confusion on this is I believe this confusion stems from the horrible stereotype of male nurses. Male nurses are apparently just doctor wannabes, or they're medical school dropouts. Pretty sure it doesn't help that I currently practice as a nurse practitioner. The public to this day still has a little bit of trouble trying to figure out what we can or cannot do, what we do or don't do. We get stuck under the umbrella with the physician assistant, mostly because at the legal practice level, nurse practitioners and physician assistants kind of follow the same path, or they're at the same level of care. But contrary to most of the public out there, I'm not a nurse simply because I didn't make it as a doctor. I actually chose to be a nurse. Is there anything wrong with being a doctor? Absolutely not. My hat's off, and much respect for everyone that has gone through that rigorous training. If I had the chance to do it over again, would I become a doctor? I don't know. Probably not. I probably wouldn't. I see what my physician partners go through on a daily basis, and they don't get paid enough. Nurses talk about the stress, the amount of stress we have because of the undaunting responsibility we have, and how we're up against a brick wall. Just imagine how physicians feel. I mean, come on, at the end of the day, no matter how much we promote autonomy within our profession, our name isn't at the bottom of the chart. They are ultimately responsible. So, for that respect, you know, I have to give them props where props is deserved. But I don't think I would want to become a physician, not only for that reason, but I like to maintain a certain level of balance in my life, something that most physicians have a difficult time attaining, simply because of the responsibility of the job itself. They work an unrelentless amount of hours, and they probably spend 80% of their lives in whatever facility they're employed at, whether that be their own practice or in a hospital. I chose nursing because of how it impacted my life. I've shared that story before. I love being a patient advocate. I love the holistic approach that we as a profession utilize. It's not just about the medical diagnoses, even though that's super important. You have to treat more than the diagnoses. You got to treat the patient. You got to treat all aspects of the patient, the psychosocial aspect. You're not only treating the psychosocial aspect of the patient, but you're attentive to everything that's going on in their lives, because it impacts their health, it impacts their medical diagnoses. And I might be biased, but I feel that we as nurses know the patients better than anybody else, and I take a great deal of pride and comfort in that. So no, I don't want to be a doctor. This didn't happen by accident. I chose to become a nurse. And I'm willing to bet most of my professional colleagues are probably going to say the same thing. What say you? What is your answer when someone says, "Oh, I thought you'd want to be a doctor," or "Why didn't you become a doctor?" Leave your comment down below. You know where your comments are, McAfee. share this with somebody. Share it with all of your nursing friends and pass it on. And as always, check your own pulse first.